Good afternoon and welcome. This is your host, Michael Z, welcoming you to Mercy Health's Healthcare Spotlight. Every Saturday, Mercy Health brings you important and helpful information that we hope will help you in your personal and family healthcare decisions. Mercy Health Muskegon offers the best of both worlds, quality local healthcare, and access to specialists, technology, and cutting-edge treatments throughout the region. Whether you receive care at our hospital or at one of our system locations, we are committed to helping you receive the very best health care possible. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health. Well, today we welcome Dr. Daniel West, cardiologist at Mercy Health Muskegon, West Shore Cardiology, and Blair Moreau, Director of Heart and Vascular Services at Mercy Health Muskegon. Good afternoon, gentlemen.
Good afternoon.
All right. Today we'll be talking about Mercy Health's high school student screenings. And I think when we talk about that, Dr. West, we got to go back a few years, 2010 or 11, I believe. And there were some tragedies in high school sports, and it sort of started things going on this. Can you tell us a little bit about the inception of the heart screenings program?
Oh, certainly. Well, we've had a concern about sudden cardiac death in young people for many years. In fact, our group purchased 24 defibrillators back in the early to mid-1990s and provided one to each school district in West Michigan, with the hope being that that would be the seed, that each school district would then see the value and purchase additional devices. Blair and I had been talking about the need for some sort of screening for high school students, but this came to fruition, unfortunately, with the passing of Wes Leonard, who was a star athlete and had died at the end of a basketball game, unfortunately scoring the winning point in the game that gave his school their first undefeated season in history. And although we had been aware of the potential risk, I think this really brought the public to the awareness that this was a potential problem. And that was really the impetus to get us moving when we did.
Yeah, and the program has grown over the years, right, Blair? I mean, we started out, getting some of the local schools, and it's really progressed and built really big.
Yeah, when we first started this out in 2012, we did roughly 1,200 kids at that time, and we have completely branched out throughout West Michigan, but we've even had children come from all the way from the east side of the state, far north as Traverse City, down for this screen, because it's not offered in all the areas. It's not recognized by the MHSAA as something that we should be screening for on a regular basis. So when they find out that there's a screen, they will come from anywhere to have their children, or parents will come from anywhere really to have their children screened for this hypertrophic cardiomyopathy is the main thing that we're looking for.
Yeah, and let's get to that. Let's talk about the main purpose of the screenings. And it's not just one specific test. There's a few things that are part of the heart screening process. Why don't we talk about what that is?
We start out with each individual filling out a questionnaire that gives us some background information. For example, many of the young people that are at risk of sudden death have a history of sudden death in their family. So we try to capture that information. We also try to capture information about any symptoms that individual may be experiencing, particularly exertional symptoms such as chest pain or fainting or inappropriate shortness of breath. Each person then goes through a process of having their blood pressure and pulse checked, and at the same time, we have staff members that will review their questionnaires, clarify any questions, help complete any questions they were unable to do, and then send the patient, I'm used to talking about patients, send the young person on to the next station. It's interesting at that station with the blood pressure check how many we found with substantial problems with high blood pressure. We're talking about people that are 15 to 19 years old. It's not uncommon to find 25 to 30% each night, high enough levels that they require a recheck before they leave our facility, and many that are then it's recommended that they be seen by their family doctor to have their blood pressure followed. Unfortunately, I think females are better than males at seeing doctors regularly, but for a lot of these young people, particularly the young men, they may not see another doctor again until they're welcome to Medicare exams. So to have an awareness that they have this potential silent killer in the form of blood pressure present at this age, encourage them to follow a low-sodium diet, to watch their blood pressure, to follow up with their doctor, can be life-saving, not necessarily in a matter of weeks or months, but in a matter of decades.
So Blair said something earlier about hypertrophic cardiomyopathy. I just just tore that one up. But explain that. What are we looking for, and what is that?
Well, the word hypertrophy means thickened muscle. And for example, you could say that a weightlifter has hypertrophy of his biceps and his pectoralis muscles, which is great if you're a weightlifter, and it's great on skeletal muscle. But when the heart is inappropriately thickened, it can cause problems. Most importantly, it increases the risk of sudden cardiac death. Hypertrophic cardiomyopathy is one of the conditions that is associated with sudden cardiac death, and one of the primary reasons that we do our screening. This is something that would not be detectable on a physical exam, can be detected to some extent on an EKG. So one of the reasons that the next station after that blood pressure check is in place is to do an EKG on each individual that comes to our screening. Now, when we set up our program, we looked at various places where similar things were done, but most importantly in Europe. In Europe, it's required that everybody has an EKG each year, and the primary thing they're looking for is a hypertrophic cardiomyopathy. So once the individual has their EKG completed and they see me, I will review their history. I will review their vital signs, their blood pressure and pulse. I will review their EKG, and I'll examine them and try to determine if I feel that individual is at increased risk. The hypertrophic cardiomyopathy not only increases the risk of sudden cardiac death, but can also affect an individual's ability to exercise. It can tire more quickly. We understand that the heart has to be strong to pump blood, but the heart also has to be able to relax to fill with blood. And a heart that's abnormally thickened doesn't relax well and fill with blood. So at times when we get the history, we find somebody who is developing an exercise intolerance that wasn't there before. So the combination of the questionnaire, the vital signs, and the EKG and the exam can give us an indication of which individuals may be at sufficiently high risk of a hypertrophic cardiomyopathy that we will then recommend that they have an ultrasound of their heart called an echocardiogram. Now, there's other kinds of cardiomyopathy. Again, hypertrophy meaning thick muscle. Cardiomyopathy means sick heart muscle. We're also looking for individuals whose hearts might be abnormally enlarged and abnormally weakened. In fact, many of the cases of sudden cardiac death that we've heard about have been individuals whose hearts weren't abnormally thickened, but they had developed some weakening of the heart muscle. Sometimes that's hereditary. We have some individuals in our community who have had weakened heart muscles that they've inherited, but sometimes it's caused by other factors such as viral infections. The same kinds of viral infections that can cause a cold or the flu, in the right circumstances, could cause the body to damage the heart itself. So the virus itself doesn't damage the heart, but the immune system, while it's attacking the virus, will see the heart muscle as a virus, and it will be like a friendly fire accident. So the immune system can damage the heart in those individuals. So a young person who was previously very healthy and does not have any kind of abnormal thickening of the heart could have an abnormally enlarged and weakened heart muscle.
So are we seeing a spike in people who have, young people who have potential of these kinds of situations?
No, I don't know that we're seeing a spike. I don't know that there's anything in our environment that's increasing the probability. Mm-hmm. I think that maybe we're screening these individuals, and it's interesting that some cases of sudden death in young people have been blamed on other causes. For example, a lot of drownings. There's some belief that some of these drownings that occur in otherwise healthy people could actually be due to cardiomyopathy. An autopsy may not be done because that individual, it's clear they drowned. They were swimming and they drowned. So it may be an enhanced awareness, but I don't know that I've seen any statistics that suggest that the frequency of these conditions is increasing.
Okay. Now, Blair, tell me about the program itself. People might be a little bit apprehensive, and particularly teenage athletes be apprehensive about going to something called a screening, particularly when their parents say, "We're taking you to a screening." So tell us a little bit about why they should, take this seriously and why it's a positive experience for them.
I'm glad that you brought that up because I'm at the end of the screen, so they have to come see me before they leave. And a lot of times when I'm talking to the children, I ask them, "Why did you come in?" "My parents forced me. My parents made me." And I said, "No, you're in here because your parents love you.
Right.
They want to make sure that you're healthy, that you got to have that peace of mind, and they have to have that peace of mind also, that you can participate in activity, not just sports, but everyday activity. But yes, they're extremely apprehensive to come in because what if we do find something wrong? And there are some of the kids that we did find some things that were abnormally wrong, electrical disturbances in the heart, and I'll let Dr. West talk about that. But the biggest thing that we're finding is the hypertension in the children. With the screens, we're over 50% of the kids that are coming in are hypertensive. And when I'm talking to them at the end and asking them about their dietary intake, it is a lot of fast food. It is a lot of sports drinks, and it's a lot of energy drinks that they're consuming. And so there's a great discussional opportunity that I get with these individuals, a great educational opportunity on appropriate dietary intake and consumption of appropriate fluids, especially the hydration post-activity. A lot of times they think that they can just go ahead and drink a whole thing of Gatorade. In reality, you only need about 4 ounces, but you should be drinking more water to hydrate the body instead of electrolyte balanced drinks such as Gatorade.
So really, this serves a little bit more purpose of it gives you opportunity to counsel young athletes too on how to be healthy. It's not just finding maybe issues with their heart, but it's also an opportunity to how to be heart healthy as they approach and participate in sports, right?
Correct. And we do have a knowledge drink test at our stations now where they can see the difference between water, milk, sports drinks, energy drinks, sodas, and these types of things, and which are the best that are going to hydrate the body and which are actually going to deplete the body of hydration.
And when you talk to the athletes and their parents about this, they're surprised to learn about some of these things? Do they go, oh, I didn't realize what I was doing to myself? Or they thought, I drink a bunch of Gatorade and I'm ready to get in the game, right?
Yeah, it is eye-opening to both the parents and the young individual. They think that, my favorite athlete or this individual, this role model that I look up to, they advertise for this product. So it must be something that if I consume, I'm going to play at that level. In reality, if you consume too much of anything, it's going to have the detrimental effect. And so moderation is okay, and my biggest thing that I keep stressing to these young individuals is the water. You have to drink the water. Things that I'm seeing is that they don't even come close to drinking what the average person should drink in a day, and they're sweating a lot. If they're participating in a sport, especially in a summer sport, and you're sweating a lot, you still have to replace that water, and they're going with things that are actually going to deplete their body or have high sodium content, and that will have the opposite effect.
Well, no, Dr. West, you've been looking at this for a long time, into the 90s, as you said. And then recently, around 2010-11, this program started, the heart screening program started. And I'll never forget the introduction of the program to the community. There was a young athlete and his mother, and he was very apprehensive to go to this test. And then the mother was there, and she was literally in tears and so grateful that they were able to find something and identify something. Tell us some of the things that you found and identified in some of these screening tests.
Certainly. Besides the problem with high blood pressure, we have found a number of individuals, if I remember correctly, about 6, with an electrical abnormality that's called WolffParkinsonWhite Syndrome. It's something where there's an electrical short circuit in the heart that typically does not cause any symptoms, but under the right circumstances, when this short circuit becomes active, it can cause the heart to go very fast to the point where it could cause someone to pass out. The individual that you're referring to had symptoms that he thought were just anxiety, pregame jitters. And when we did his EKG and we found this abnormality, I referred him to an electrophysiologist who is a cardiologist/electrician who specializes in the treatment of electrical abnormalities of the heart. And by doing a simple procedure, by passing an insulated electrical wire through the vein in the leg up into the heart, the short circuit can be identified and then treated with a small amount of high-frequency energy that eliminates the short circuit, and the problem goes away. Not only do the symptoms go away, and not only does the risk go away, but the EKG goes back to normal. Because in some of these individuals, not only is there a risk of feeling jittery or even a risk of passing out, in a very small percentage of these individuals, there's actually a risk of sudden cardiac death.
And really, by ignoring or avoiding screenings, you're kind of gambling. You're taking a gamble if you're a young athlete or if you're a parent of a young athlete. This is something that you really should take the time to do, right?
It takes about 15 minutes of your time. From the time you come in, register, to the time you walk out. Even if you have the echo, it's no more than 15 minutes. Now, here's the greatest thing. It's free.
Right, yeah.
It doesn't cost anything but 15 minutes of your time to give yourself peace of mind, to give your parents peace of mind that you can participate in an activity without any danger. Now, a question that comes up on a frequent basis during the screen is, do I have to have this yearly? Or is one screen, one time coming through, good enough? Now, you talk to Dr. West already mentioned that we get viral infections. And the viruses will attack the body, and particularly they like the heart. So, yes, we recommend that you have the screening on an annual basis.
And speaking of that, why don't we take a second? Can we mention some of the upcoming screenings and where they're at?
Yes, we have our first screening coming up on this Wednesday, March 15th. All the screenings are at our Hackley campus in the Youngberg Auditorium. The next screening after that is April 26th, then July 19th, August 9th, and then finally our fifth and last screen will be August 23rd.
And they can be found at mercyhealth.com/student heart if they're interested. Let's talk a little bit more about participating, about the program itself. It's a free program, as you mentioned. How are you able to do this? I know a lot of people donate their time probably to this, and there's a lot of good people from Mercy Health that participate. But let's get to how we're able to put this program together, offer it for free, and really encourage folks to get out there and participate.
Oh, certainly. It's interesting that it's hard to imagine, but our program is controversial. And it's controversial because when they look at the, if I can use the term, cost-benefit ratio, it would be said that a program like ours is too expensive for the small number of lives that we would save. Which, when you look at the fact that we're doing it for free, you take the cost end out of it, and all you have is benefit. But there have been other, medical groups that have, said that our program is well-intentioned, but it isn't sustainable because this cost-benefit ratio factor. But we have had an enthusiastic core of people that have worked with us. We have nurses. We have medical assistants, we have exercise physiologists and EKG technicians and echo technicians and cardiologists and internists and other staff members that have been integral to this program. And each and every time we do it, we have, what would you say, Blair, 20 or 30 people there to support us to make this program work. So it only works because of the people of Mercy Health that are willing to take the time to come down here and help us. And it's a 3-hour program. By the time you get set up and leave, it's a 4-hour commitment. And I just can't thank these people enough because obviously Blair and I no way could do this without them. This is something that takes every single individual that shows up to help us. Yeah,
I was just going to ask you, as far as, and yourself, and speaking for the others, to participate in a program like this, there's got to be some satisfaction to helping out the community and helping out the kids of this community in a program like this.
Well, I have teenage children, and I want them to go through this program, and my oldest daughter has, and I want it to be sustainable so every parent that wants their child screened can get that peace of mind. And the volunteers at Mercy Health have just been unbelievable. The only thing we give them is food, and they show up.
Yeah, right. Right. So, Dr. West, so what are some? You alluded to one of a couple of the conditions. Are there any others that during the screening process that we discover or that we look for in this whole process?
Well, it really boils down to either electrical problems, and I talked about WolffParkinsonWhite because we found several. We have not found other electrical problems that have required any specific specialist care. The blood pressure I mentioned. And again, the other issue being either the abnormally thickened or the abnormally enlarged and weakened heart muscles. Those are the primary things. And understand that this is not a comprehensive cardiac evaluation. When I see a patient in the office, it takes me 45 minutes to see one individual, and I could easily do testing that would cost $2,000, $3,000, $4,000 to evaluate someone for specific symptoms. This is a program that we can handle a large percentage or a large number of students each session, and we do it for free, and we can run them through in 15 minutes. So obviously it's not a complete cardiac evaluation, but our goal is simply to look for those conditions that place those individuals at an increased risk of sudden cardiac death.
Let me ask you this. As a cardiologist, you've been in this game for a while, and it's good to speak of it as a game. You've been in this for a long time. What is your passion? Why is there a passion for this particular facet of your care? I mean, you've got young people, obviously, and you've been at this for a long time and talking about we need to do this, we need to do this. What's your passion on this?
Well, as Blair mentioned, I'm also a parent, and I've got several kids and care about their health and well-being. I was an athletic trainer when I was in college, and so I became interested in exercise physiology and the heart, and that's what really led me to become a cardiologist in the first place. When I was in training in the University of Vermont, we had, it's similar to Wes Leonard, we had the star athlete of the state of Vermont who died of sudden death from a cardiac condition that at that time was not fully understood, or there was not an opportunity to treat that person. So I became painfully aware of sudden death in young athletes in that stage of my training as well. But I think that when I see cases such as Wes Leonard or some of the other cases that have occurred around our area, it just makes me believe that if even with this energy, if we could save one young person, we may screen, and I've seen numbers, and I don't have that number right in front of me, but that we'd have to screen something on the order of 250,000 kids to save one life. I recognize that. But if we can find that one kid, and maybe we have, because we found not only these electrical abnormalities, we did find one individual with an abnormal heart muscle and referred him to the appropriate specialist. So, but we're going to keep going. And if it's your child or my child or Blair's child or someone that I don't even know, if there's any chance at all that I can find something and prevent a tragic death, I'm willing to put forth my time and energy to do it.
And Blair, if for those kids out there, and you've talked to them as they come through the program, the ones that might be out there listening today, this afternoon, and their parents, what would you say to them right now? Is like, well, we're thinking about this, or I saw it on the calendar, but what would you say to encourage them to come down to these screenings?
Go on the website and register. It takes 15 minutes of your time, and it's going to give you a year of peace of mind that your child is going to be able to participate in the activities that they like to participate in with really a very low risk. So it just takes a small amount of time. Don't wait, because we have this happen every single year that we give, 150 some kids on this very first date. About 20%, 30% won't show up, or they'll end up canceling. And that happens throughout the first four. And then finally, that last date, we're getting phone calls saying, you guys are full. I want to get my child in. We have 5 dates. Don't wait until the last one to try to get your child in to get that peace of mind. Do it beforehand, and then you won't have to worry about trying to get them in. Now, there are even some schools that are saying they would really like their kids or student athletes, not all the kids, but their student athletes, to really start participating in this screen, but it isn't mandatory yet.
Right. Now, Blair, you've really been involved in the community, as Dr. Wes is. Today we're out at the ride. And for you, what do you think this means to the community to have this type of program for the community?
Oh, I think that having this student screen for our community, it raises us up. Because to me, there's nothing better. Like Dr. West said, we have to screen about 250,000 kids to find one. But what if that's my kid?
Right.
What if that's my child? Now my child's going to be on this planet for a lot longer than what they potentially could have had. Now, I'm glad that you mentioned the ride, because I had that in my mind also. Part of the ride actually portion of the ride money that we raise actually goes and helps us put on these student heart screens. So that offsets some of the money that we have for this to put these on.
So if you're at the ride today, you are helping this program directly.
Oh, yeah. So show up at the ride. Even if you're not riding, show up and give your energy to those that are riding.
Yeah, stop by right now because they're still out there. I know they are. So
we'll be there till 4.
All right, there you go. Dr. West, anything else you'd like to add about the importance of this program and the fact that once you go through this, it's a positive experience. There's things that we can help you with when we find things.
I think I'd really like to see more thorough participation from some of the school districts. It's interesting, we have some school districts where we get tons of the kids. And to name a few, Grand Haven, Mona Shores, and it's not been uncommon to have weeks or sessions where we've had more people from Grand Rapids than we have from some of the school districts right here in Muskegon. In fact, Muskegon High School, we're lucky if we get 1 or 2 individual each time we do a screening, and we may get 25 kids from Granville or from Rockford or from Kentwood. So I just want to encourage the individuals here from Muskegon. This is here. It's convenient. As Blair had said, it's the parents that drag the kids down here. I can't remember a single kid that's come down there without their parents encouraging them. So it's an important program. It's something that 99.99% of the time we're not going to find anything serious. But if that's going on and we can identify it and do something to prevent an unfortunate, untimely death, we want to do it.
And speaking of that, I mean, it's good to hear that we need to get more participation here in town, but it's also amazing that this is spread. This program is so successful. It's spread out to, like you say, Grand Rapids and beyond. You're getting kids from all over. Tell us a little bit about that, Blair, and the satisfaction of having these screening participants from all over the West Michigan area and beyond.
I'm glad that Dr. West brought up Granville, because they are probably one of our largest schools now that are utilizing the screen. They had a tragic event that occurred there about 3 years ago.
The hockey player, right?
The hockey player. Yep. And every single hockey kid now from Granville comes to the screen. So that gives a lot of satisfaction that they recognize that this is important to give that peace of mind, to make sure that their athletes are going to be healthy throughout the season. But yes, to see these kids from the Grand Rapids area, from the Lansing area, from the Traverse City area, come all the way to a screen where we're only getting a small amount of those individuals from our own area coming to the screens.
A little bit frustrating there.
It's yes, and we don't know. We've tried a lot of different types of tactics to get those schools to participate, but I think that we could do better. I started bringing flyers to the home Montague games. So those people from Montague, I'm going to be pushing all you to be coming to the screen from now on. But I think that we should start doing those types of things, to have flyers available that we can bring to the schools, put them at the concession stands or at the ticket booths, and people can grab them when our screens are coming up.
Pretty good stuff. Well, Dr. West, Blair, we're winding down. Dr. West, any final thoughts as we segue out of the show today?
Well, I think that we would like to encourage other medical groups around the state to pick up this program. We're not jealously guarding this as our own idea. This is something that we actually adopted from William Beaumont Hospital in Royal Oak and from the experience in Europe. We want other programs to do it. We want the people in Grand Rapids to be serviced closer to home and the people in Lansing and in Ann Arbor. So again, this is not something we will share our experience with anybody out there that would like to hear how we do it. We would like to grow our program, make it stronger, and again, have it spread throughout the state.
Yeah, that's great. Well, thank you, Dr. West and Blair, for coming in.
Thank you for having us.
Well, we want to thank our guests today, Dr. Daniel West, cardiologist at Mercy Health Muskegon, West Shore Cardiology, and Blair Moreau from Mercy Health. Today's broadcast is brought to you by Mercy Health Muskegon. Please join us next Saturday afternoon for another edition of Healthcare Spotlight. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health.